Do you want to have cup of coffee or tea? Mellenbach medium. In my previous story, a laugh is just a smile that lost control. I began to talk about my breast mammogram. It was type 1 cancer. I was shocked to find this out. I went to have my breasts checked once a year. They called me back to have my left breast checked again. This happens every year. The left breast was too dense, so I had to go back. This time, it was cancer. Cancer. The first time in 10 years. If you remember, I messed up my first surgery and had to cancel it on June 5th. Banana. They set a date on 18 of June. I was ready, as I thought I would be. I went to the hospital on June 18th. I had to go first to get my left breast seed. A radioactive seed localization is done by radiology to help your surgeon locate the area of breast tissue that needs to be removed. Before your surgery, a radiologist will take pictures of your breast using a mammogram or ultrasound. When I went to check in, the girl asked me if I had a ride home. I said yes with Uber. She then asked me if I had family or a friend to ride home with me. I said no. She called my doctor, and she said I have to have a family member or friend with me on my way home, or stay in the hospital overnight. It was because of the anesthesia. I said okay. I will stay overnight. I felt miserable because I had a small dog named Jada. Who is going to let her out or feed her? She was going to tough it out. I haven't told her anything yet. After that was done, I went to the room, where there was a nurse to get me ready for my surgery. She asked me several questions about my past and present. In came an anesthesiologist. He did the same thing, asking me about my past and anything about my present. I was ready to go. Until I had to have a surgical breast biopsy, which is performed by a surgeon or radiologist in an operating room. It involves making an incision in the skin. A needle biopsy is performed by a radiologist in an exam room or radiology suite. It is done by inserting a needle through the skin. This time, I was really ready. I was in the surgery room. Now I am taking my gas to make me go to sleep, that's all I remember. I woke up feeling fine. There were 2 bandages on my left side. I asked the nurse if I was all done. She said yes, and I fell back asleep. Lol. I woke up in my room. There was a nurse who was fitting my legs, with intermittent pneumatic compression. What is that? Intermittent pneumatic compression, IPC, uses a simple machine to help prevent DVT. The device has 2 cuffs that automatically fill with air and painlessly squeeze your legs. This increases blood flow through the veins of your legs and helps prevent blood clots. There are many types of IPC devices. The cuffs may cover your calves, or they may go around your thighs and calves. A nurse or aide will apply the IPC cuffs. They may show you how to take the cuffs off and put them back on. When fastened around your legs, the cuffs should feel snug, but they shouldn't be too tight. You should be able to place a finger between the cuffs and your legs. Next, the cuffs are attached to the compression machine. The machine will cycle between inflating and deflating the cuffs. This may feel a little strange at first. Let your healthcare provider know if it's uncomfortable. Call for help if you need to get up to use the bathroom, go for a walk, or take a shower. Your nurse will help you take off your cuffs before you leave your bed and put them back on when you return to your bed. If your healthcare provider has told you not to get up on your own, don't leave your bed without help from staff. Always take off the cuffs completely before leaving your bed. I was hungry. When I woke up, the nurse ordered me a light snack. Grilled cheese. That was all until I got in my room, 562. It was 12 o'clock midnight. I woke up at 3 a.m. I stayed awake the rest of the time I was in the hospital. I got a consent to go home, at about 7:45. The nurse came and questioned me and said I was okay to go home. She gave me a folder listing my instructions for home. She took me downstairs in a wheelchair, and I was off. The surgeon said there was a plastic wrap around the cancer. Inside the plastic bag was cancer, and around it inside the plastic bag was normal tissue. She would send the plastic wrap to a pathologist. He or she could tell if it was cancer, and I needed chemo. The pathologist will tell my surgeon on June 24th. So, I will have to wait until then to know if I am going to be okay. The surgeon will talk to me then. More waiting. The surgery is over. That is the best thing. Thanks, Marie. Promotion with friends. A link. Medium.com/@melonbach83. momentstossup.com.etsy.com